Good afternoon, everyone, and welcome to today's press conference for Friday, the 29th of January. We've got some new faces with us today. We've got Nisha Patel, who's the COVID intelligence lead for public health and the CCH. And we've also got Chris Pallett, who's the program director of the COVID-19 vaccination program. I just thought I'd introduce them as Lucy Whiteman is having a well-earned day off, as I think we can all agree she's worked extremely hard. We are live on YouTube, so we have to be a bit careful of our language, as always with these things, and obviously it's being recorded at the same time. Today, we normally take questions in the chat function from members of the press, but we're not going to do that today because we find it, we run out of time and it all becomes a bit rushed at the end. So we will give you an opportunity to ask further questions if there is time at the end by using the hands up facility. But if you could refrain from putting questions in the chat, that would be great. So today we have, as I say, Nisha Patel, who's our COVID intelligence lead. We have back with us Deborah Needham, who's the hospital CEO. We've got Chris Pallott, who's the program director of the COVID-19 vaccination. Coming back to see us again is Dr. Joe Watt, who's the GP chair for the Northamptonshire Clinical Commissioning Group. And again, back with us is Superintendent Elliot Foskett from Northamptonshire Police. We've also got in attendance Roslyn Harris, who's a consultant in public health, Katie Brown, who's the Director of Adult Social Care at Northamptonshire County Council, and Paul Andrews, who's the Northamptonshire County Council COVID Education Cell chap. We also have Jonathan Nunn, who's the leader of the Borough Council, and we also have Tom Beattie, who's the leader of Corby Borough Council. So thank you very much. The order will be Nisha, then Deborah, then Chris, then Joe, then Elliot. And then we will open up the conference to the written questions, which you very kindly submitted in advance. As I say, if we have time at the end, we may allow a few questions via the hands up facility on the chat. So we'll go straight to Nisha. Welcome, Nisha, and she can give us our COVID intelligence pack for this week. Welcome, Nisha.
Thank you very much for having me. Good afternoon to you all. As described, I'm here in Lucy's absence to really just talk to you through the intelligence aspects of this week's COVID-19 situation. The information in this pack in the main covers the period the 18th to the 24th of January. And during that time, we saw 3,009 people test positive for COVID-19 in our county. So in terms of the kind of key messages that we're starting with here today, clinical vulnerable people who are shielded in the first lockdown are being urged to do so again, even if you've received both doses of vaccine. As described, we've got a number of cases, which we'll go through the detail of in a moment. From what we can see at this moment, the mixing between households, in spite of all the lockdown rules currently in place, is still the primary cause of transmission in our county. So if we launch straight into the data, if we could go straight to slide 5, please. Thank you. So from this slide, we can see we have, like I said, just in excess of 3,000 positive cases in the last week in our county. And I just want to pause for a minute just to put some of that into context for people on the call. In the last 4 weeks, we've had in excess of 16,000 people test positive for the disease in our county. Now, if each one of those individuals was to take a seat at Franklin's Gardens, we couldn't accommodate them all. Just picture that. I know numbers, when we talk about them in these packs, can lose their meaning eventually, especially when we talk about such big numbers. And I hope that's an easier way to picture the scale and the size of our January challenge in Northamptonshire. Now, on to slightly more positive news. As you can see, I'm pretty encouraged to report that for the second week in a row, we've seen decreases in case rates locally. Things are definitely going in the right direction. However, the rate of decline in Northamptonshire and our region more generally appears to be slower than the national picture. I'm sure I don't need to labour the point, but we're still not back at pre-Christmas levels, and I'd implore everyone in Northamptonshire to keep doing their bit in combating this illness. If we could go to the next slide, please. So the picture in terms of falling cases on the previous slide can now be seen here in terms of the breakdown at district and borough level. And again, we can see some signs of hope here. Most areas are showing decreasing numbers of cases compared with last week. However, the county position does often mask those variations when we look at the lower geographies. And in this case, we can see that East Northamptonshire had greater number of cases this week compared with last. If we can go to the next slide. Of course, numbers aren't always comparable when we look at them through lower geographies. So we continue to look at them through rates per 100,000. And when we do that, we see that as a county, despite falling cases, we still have statistically significantly higher case rates than England levels across our county. In short, there's still a lot of work to do. We still see statistically significantly higher case rates in Northampton and Corby boroughs compared with our county position, but also compared with that national position. And this is despite the fact that both those areas have seen decreases in the last week. Next slide. Now, this is something that we've added this week. It's new, but it does come from a government website of published information. I know that people will probably find some of these key messages a little bit confusing, and I wanted to help people understand that dynamic of growth in cases and subsequent falls. What we're trying to do here, we can see that percentage changes in case rates over the last 3 months. And what we can see is a picture where case rates increased more rapidly in December than they did ahead of the previous lockdown in November. And they've also decreased more slowly this time around following the implementation of the January lockdown. So I know people are tired, and I am too, but really this is not the time to give up. I hope this makes people feel that there is still a lot more to do to protect lives in our communities. Next slide. And talking about protecting lives, this is the sobering part of our world right now. Last week, we lost 58 people to this disease in Northamptonshire. And that means that to date, we've lost 1,144 people in our county. Thankfully, the number of deaths in the last week have decreased compared with the previous week, although there are more deaths this week in East Northants compared with the number for the previous week. Next slide. If we could actually skip to slide 12, please. So while cases in the last month continue to be focused on those middle age bands that we've been continuing to see highest cases in for the last few weeks, we've seen, mainly working age people affected. There is always a greater concern for older people in our county. And I hope, like me, you're encouraged by what we've seen in this slide in recent weeks with, particularly really large falls in case rates in older people in Corby that we can see. However, you'll note that the case rates in this age group have somewhat plateaued in the last week. We haven't really seen as much change as we would have really liked. And for us, this is really a concern given the risk of hospitalisation, which we'll come on to in the next slide, please. Now, I'm not going to go into too much detail on this. I know that there are better qualified people to talk about hospitalised cases than I am. But what we can see here are the number of people in hospitals falling in recent days, with 346 reported for the 26th of January. And that is down from a high of 422 earlier this month. But please, let's not breathe a sigh of relief just yet. We continue to see daily admissions for COVID at both our hospitals, so the tap hasn't been switched off completely. And complacency in community infections may risk turning the tide on hospital pressure once more. I think we're seeing some signs of hope again here, but the job is far from being done. If we could go to slide 17 on outbreaks, please, now. While wider community cases and case rates are falling, outbreak numbers are similar to the position that we were showing last week, with 58 outbreaks this week affecting 625 people. Care home outbreaks are up by 3 this week to 48, but workplace outbreaks are down this week to 5 compared with 9 last week. So managing this remains a focus of multiple teams and organisations who all continue to work in tandem to keep people safe. But how do we all do that? How do we all play our part? Well, this is part of the kind of key messaging this week in our packs, which you can see on slide 4. But what we can all do is go forward for testing when we need it. There is ample testing in our county, and we'd encourage people to come forward for that. Please get vaccinated when you're called, and let's not be complacent at this point. I'll leave it there, Councillor Morris, if that's okay.
Thank you, Nisha. Thank you very much for that run through on the figures. Some sobering figures in there. And I, as you say, the time is not for celebrating a victory over this disease in the county or indeed across the country. And yeah, so we need to carry on doing what we're doing and keep doing it for quite some considerable time, I suspect, in order to see things turn around. So I'm going to come now, as you mentioned hospitals, I will come to Deborah Needham now, who's the Northampton General Hospital Trust Director. Hello, CEO, sorry, I downgraded you there, Deborah, I do apologise. Deborah, over to you.
That's okay, thank you, Councillor Morris. So as Nisha has just mentioned, COVID cases remain quite high across our community at the moment. And of course, that is still reflected in the number of patients in both Northampton and Kettering hospitals. We are caring for large numbers of quite poorly patients who are actually staying in our wards for much longer than we've seen before they're able to return home. We have created extra capacity, but the demand that we have coming into both hospitals remains still quite a challenge for us. So as well as the high number of patients that are coming into our hospitals with COVID, we are also dealing with the winter pressure that we would normally see at this time of year, which means that our staff are working extremely hard to make sure that everybody is safe. Whilst total numbers of COVID positive patients are decreasing, and we've just seen that, the pressure on our hospital, including critical care units, is expected to remain quite high for quite some time and beyond the peak of the latest wave of the pandemic. So today, I know that Nisha has just shown some numbers, but today we've got 295 positive patients in both of our hospitals, and 27 of those patients are being cared for within critical care. Now, our staff have just worked incredibly hard to provide outstanding care for all of our patients. And I just feel so overwhelmingly proud every day for everything that they're doing in such challenging circumstances. But what I must say is our staff are tired. And as you'll have read in the news recently, mental health for NHS staff is now a fairly major concern. It's also a great concern to me, but we are doing everything in our gift that we can do to keep our staff safe and well. My ask today really of the public is that you continue to help us by remaining vigilant at all times and sticking to the rules. So we've also had to reduce some of our non-urgent activity to focus on patients at the front door with the urgent need, the immediately life-threatening conditions that we see through our A&E department. But what I also would like to just let the public know is that we have continued to focus on cancer care and clinically urgent surgery in both hospitals. As we're doing as much activity as we possibly can do. We have created extra capacity by using operating theatre space at the private sector hospitals, but it does mean that we have had to postpone a handful of elective operations. We're continuing with our outpatient appointments, as you will have heard me say before. Many of those are now being held virtually, so patients are only travelling to our hospitals when we absolutely need them to, when it's absolutely necessary, which could be for a physical examination or treatment, or it could be a blood test, for example. You'll hear more about the vaccine delivery programme shortly, but that's going well. The teams across Northamptonshire are doing a fantastic job in delivering this to so many people already. And we've also got plans within the next few days to be delivering the vaccine to some of our inpatients within our acute hospitals. We must remember, though, at this point, that full protection from this vaccine won't be achieved until we've got a significant proportion of the population having had the second doses. And until then, my ask to you, the public in Northamptonshire, is to stay safe, stay well, kindly stick to the rules and the guidance, please, in order to protect my staff going forward. And I'll stop there, Councillor. Thank you.
Thank you very much, Deborah. And I know how busy you are, so we really do appreciate you coming to these and all the hard work that you and your colleagues do on our behalf. It really is heartening. And I'm going to come now to Chris Pallow. He represents the light at the end of the tunnel. He may not actually be the light at the end of the tunnel himself, but he does help deliver the light at the end of the tunnel. And given the news in the last few days of yet another vaccine possibly arriving in this country in the not too distant future, I think it's a very important area. And of course, I've been very impressed with our rollout across the county. It really has been a team effort, and an awful lot of work has gone in. And I think I can say, I'm not sure Chris will say it, but I can say that we are doing exceptionally well compared to some of our neighbours and various other counties. And it really is an amazing effort. So I'm going to hand over to Chris Pallow, who, as I say, is the COVID-19 Vaccination Programme Director. Chris.
Thank you, Councillor, and good afternoon, everyone. So the update from me is the big news this week is that our vaccination centre has opened at Moulton Park, and this provides another choice for patients to be able to obtain their vaccines alongside the 16 primary care network facilities which have been open for some time. Primary care has been the mainstay of how we've been able to deliver our performance so far, and I'm hugely grateful to all of my colleagues in that sector who have moved mountains to deliver so many vaccines to our population so far. The 16 primary care networks cover all of the area of our county, so our patients absolutely have the choice of receiving the vaccine in their local primary care facility, or they can also choose to come to the vaccination centre. I know Dr. Watt is going to cover this a little bit more in the future, so I won't go too much into the process unless there's any further questions later on. Up to now, we have also been vaccinating mainly our staff, but also some care home colleagues and also some over 80s at our 2 hospital hubs. We've made such good progress at our 2 hospital hubs that from this week, we'll be transferring that service into the vaccination centre. So going forward, workers who are in the health and care sector, either from the hospitals, our colleagues in the community and mental health services, or primary care, or any other health-related organisation such as dentists or optometrists can receive their vaccine here, because the first 4 cohorts cover the population over the age of 80, then 75, then 70, and professions which are aligned to health. That is what we are working towards delivering by the middle of February to ensure that we meet the Prime Minister's mandate. We have sufficient vaccines being promised to the county to ensure that we meet that, and we have seen none diverted elsewhere. That's a really positive news for us. So we're absolutely focused upon delivering that. So far, we have delivered 86,000 vaccines. This was the data from yesterday to our population. That will have gone up over the last 24 hours fairly considerably. And the really pleasing news is that over 87% of our over 80s in Northamptonshire have been vaccinated. And as Councillor Morris kindly said, that is one of the best performances that there is in the country. This is a massive team effort. And I would just like to pay tribute to my colleagues from both acute organisations, from Northamptonshire Healthcare NHS Foundation Trust, from primary care. Our first responder colleagues from East Midlands Ambulance Service are part of this too, along with many others as well. Without that staffing being made available, we would not have been able to open the vaccination centre, but there's something very important with regards to that, is we have not taken staff from any frontline service. We have opened the vaccination centre using staff from many different organisations who have made themselves available to help. So we will go from strength to strength with regards to all of our services, and today is the first day that every slot that's available for NHS patients has been filled at the vaccination centre. So that's hugely pleasing, and we're on track to deliver the mandate by the middle of February. Thank you, Councillor.
Thank you very much, Chris. Really do appreciate that update. It is very heartening, as I say, and I know he won't say it himself, but he has actually been vaccinating people as well himself, I believe. So, you know, he really is at the front front of that service, as well as giving us the good news generally. So thank you for that. I'll come now to Dr. Jo Watt. Welcome, Jo, who can give us a primary care view on where we're at the moment. Jo.
So thank you, Councillor Morris. So very much building on what Chris has said, there has been an enormous effort. That's been very much professionals working with volunteers and with the public, and people really very enthusiastic to get themselves vaccinated. Again, really important that they can't abandon any precautions once they're vaccinated. We're not yet at that stage, but this is definitely the beginning of seeing our way forward and moving out of this phase. We know one of the particular issues this week is that those people in the eligible groups have received a central letter from the NHS this week, and we know that that has caused some confusion. And really just wanted to try and make that clearer for people, that essentially those people who are in groups 1 to 4, I'll go through those in a moment, are being offered a choice of different places. If you already have an appointment booked, please don't cancel it, because your clinic will have laid on staff, will have made assumptions with that. So if you've already got an appointment, keep your appointment. Many people will choose to be vaccinated close to their homes. There will be a GP surgery near to you, not necessarily the one that you're registered with, but your own surgery will be able to book you in. Equally, for some people, it may be preferable to attend the mass vaccination centre, but it's important for you to remember that you will have your second vaccination at the same place that you have your first. So do think about where you're going when you're booking that appointment, and it is important to keep those appointments. And if for whatever reason you can't attend that appointment, please do let them know. Those appointments are very precious. Many people would want them, so please notify if you are unable to attend that appointment. It's also worth mentioning that you need to wait 28 days after you've had COVID before you can be vaccinated. And so if you're offered an appointment during that time, please do postpone that appointment. There will still be vaccine available for you. As I say, the main thing is, please don't be confused by the letters. We know people have put a lot of queries in, but they're offering you a choice. It's telling you that you're eligible, and that's for Group 1, which is care home residents and workers, Group 2, who are health and care professionals and those who are over 80, Group 3, that is the over 75s, and Group 4, which is the over 70s, and those who are clinically extremely vulnerable, also known as shielders. You will know if you're a shielder. You will have received a number of letters, not least back as far as May. Your GP surgery will have gone through your records to establish that you're a shielder. If you haven't had a shielding letter, it is very unlikely somebody is suddenly going to decide that you're a shielder, so you are not in that group. One of the groups of people who sent a lot of queries into GP surgeries are those people who have other long-term conditions, also known as clinically vulnerable. And those people are Group 6, and we are not yet vaccinating you, but if you wait, we will call you for those appointments when they're available. If you're not sure if you're Group 6 or not, it's probably worth thinking about as an adult. Do you normally receive a text from your GP surgery reminding you to have your flu jab? Generally, if you receive a text that says it's time for flu season, and you receive one of those every year, you are likely to be in Group 6 rather than Group 4. So if you are one of those people and you've not previously had a shielding letter, please wait. You will be called, probably a text from your GP surgery, or you may receive one of these central letters, but please do not call your GP surgery because the lines are very busy. The people who should be calling their GP surgery are people who particularly think they may be unwell with other things. And as Deborah mentioned, cancer services are still running as normal. It is particularly important that we don't forget about other conditions. So if you think you have a serious condition, particularly cancer, it is still really important to contact your GP surgery. They will be able to refer you as normal, and we really don't want to miss other conditions. And in particular, mental health is a big issue at the moment for a lot of our population. And you can contact the mental health hub, but you do not need to go through your GP to do that. There are lots of services that are available for you. And so those are not things that we would want people to ignore. And what we really want to do is just encourage people to stay safe, look after yourself, continue to observe all of the guidelines, whether you're vaccinated or not, protect the people in your community. Please wear a mask. Please cover your nose as well as your mouth. Really, really important. And thank you to everybody who has been so kind, to all the health and care professionals that are working It's hard work, everyone's working hard, and a little bit of kindness from the general public is so appreciated. So thank you to everybody for your kindness.
Thank you very much, Joe, and you certainly deserve kindness currently. So we of course very much appreciate the work that you do, especially at this time, and you being here today as well, because we know how busy you are. So thank you very much. Some very good points there. I'm going to come now to Superintendent Elliot Foskett, who will be able to tell us about one of the very important areas, which is enforcement for the rules. Elliot, good afternoon.
Good afternoon. Thank you, Councillor Morris. Okay, I'm just going to give you a very brief overview to start off with of the past 7 days. We've had around about 459 breaches reported to us over the past 7 days alone, which is around 65 a day, and we're getting to around about 70% of those. And the ones that we're not, we're following up and referring on as we need to. Since the start of the lockdown, we've had reports of around 1,800 breaches reported to us, and again we're getting to around 70% of those pretty much every day. We've continued to see quite a high level of response to things like enforcement, which I'm going to come on to in a minute, and I know has been reported widely in the press this week. Traffic flow has been down again this week now, down to about just shy of 40% down on what it was pre-lockdown. I expect that some of that will have been caused by the inclement weather at the start of the week, though, but we are still seeing sort of reductions in traffic, but though, again, as I said last week, nowhere near the scale we saw during the first lockdown. So onto enforcement, high levels of enforcement from us, as you will have seen in the press, and the figures I'm going to talk about today, and I think this answers maybe one of the questions that will come later on. The figures that I will talk about are actually fines given out by Northamptonshire Police now, today, as we talk about it, and not the ones that have been processed and gone through. So there's a slight delay on the ones that get reported nationally compared to the ones that we talk about, and I'm going to talk about today. So I can report that since this lockdown, we've given out around about 700 fines, not the 400 and something that was printed because of that delay, and 180 in the past week alone. And the majority of these fines now are issued for offences in relation to people mixing in houses. And despite messages over and over again, week upon week, and from public health officials and from ourselves, people to continue to breach occasionally by mixing with households they're not supposed to do. We still do see some mixing outdoors that shouldn't happen around country parks. And again, like I said last week, our officers are out and about, as are local authority colleagues as well. So we will be enforcing on those. We've been exceptionally robust as a county in relation to enforcing on face coverings, and we're one of the only forces in the country to have taken such a strong line on this. And I have been asked to comment on why that is. Well, you know, we all know that maintaining 2 metre distance is probably one of the best things you can do, but the wearing of PPE and face coverings is absolutely vital. And the majority of people in this county continue to play their part, but there are some people who continue to be irresponsible, continue to ignore the rules, and therefore we feel that it's the right thing to do by our public and in support of our public health colleagues to enforce on those regulations. So yes, we are extremely robust on it, and probably head and shoulders, I guess, above some of our other forces, in fact every other force in the country. I think it's just probably come upon me to say at the end here, you know, I think to quote Dr. Whitty, really, there is light at the end of the tunnel, but we're not there yet. And you can see what, you know, from the figures that Nisha quoted earlier on, we're making progress, but even the figures now are so high compared to where we were only a couple of months ago. It's time for everybody to just think again. Do not relax. Do not let this become a signal for people because figures are falling to think I can just go and do that, or how can I bend the rules slightly, or will I get away with it if I do this? It's not good enough. You can't do it, and we will enforce and we will give you a ticket if that's the case. Thank you.
Thank you very much, Elliot. And as always, our thanks to you and your teams that are out there keeping us safe and enforcing these rules. It's good to hear that we're the #1, if you like, for enforcement, although of course it would be nice if we didn't have to enforce so much, but that's just the facts. And thank you very much from all of us, I'm sure. So I'm going to open up for the questions from the media now. So the first one in is Laura Coffey from BBC Northampton. Hello, Laura, how are you?
Hi, Councillor Morris. Yeah, very well, thank you. So yeah, a couple of questions. A couple of additional ones that I've got as well. So firstly, we've heard from day centre staff and private carers that they can't get vaccines yet as they're not directly employed by the NHS, even though they're dealing with the most vulnerable people in a very hands-on way. Can you locally decide to include them in this part of the vaccine programme? Can you confirm how many deaths from COVID-19 there have been at Seagrove House care home in Corby? And an additional one on that one, the number one priority group for vaccinations is residents in care home for older adults and staff working in care homes. It's already been mentioned today that there are 48 outbreaks at care home settings. Have vaccines been carried out at any of these sites that have had outbreaks?
Thank you very much, Laura. I don't think Katie will probably be able to talk about specifics at specific homes, but she is more than happy, I'm sure, to answer generally those questions. Katie, thanks for joining us, Katie, as always.
Thank you, Councillor Morris, and good afternoon, Laura. So in answer to your first question, those staff that you've identified are eligible under the cohorts, and we are contacting all providers that we know about to ensure that they have access to the booking system. As you will appreciate, this has been quite logistical in terms of the volumes. So we're talking hundreds of providers that are covered in that cohort. My plea to the provider market, particularly day services, is that you will be contacted. We haven't forgotten about you. And by next week, everybody that we know about in terms of registered providers will have access to the booking portal to book their staff in for vaccinations. Personal assistants are slightly different in the sense that they are employed by individual people that have normally budgets or are self-funders for their individual care and support needs. We are setting up that service for them in NCC next week so that we will book that for personal assistants and we will book their appointment for them at the vaccination centre. We will put out further information on our communication channels, but we do have a network that work closely with personal assistants and the service that we have here at NCC, and we will be contacting them directly at the beginning of next week to arrange that. But just to say that in the scheme of where we are on track to make sure that all of those social care workers that are included in that priority cohort 2 will be offered a vaccine before the mid-February date, and we have hundreds and hundreds of those providers that are able to book vaccinations for their staff at the moment. As Councillor Morris has alluded to, we won't be commenting on any specific details at this time about anything that we are currently dealing with. Just as put for context around the outbreaks, they aren't just care homes, they are care homes and care services, including domiciliary care services. So they are all different by nature in terms of where they are. So we will obviously we are following all protocols and processes in conjunction very closely with Public Health locally and Public Health England.
Thank you very much, Katie. And just to reiterate, as the Cabinet Member for Adult Social Care, adults in care and their carers remain a very high priority for all of us in this county. And we will continue to do what we can to look after them and make sure they are vaccinated, as Katie says. So thank you, Laura. I'm going to come on to Kevin now. Kevin Nichols from the Chronicle and Ech. Hello, Kevin. I think your first question may have been answered by Elliot already, but
yeah, he certainly did touch on it. Thank you, Ian. He certainly did touch on it. I'd like to just clarify if this is a departure from previous practice, that we're now going to be getting up-to-date figures rather than having to wait till the end of the month. And I am also still curious that the number of £10,000 fines that were issued does seem to have decreased rather than increased in the last couple of weeks. I wonder if you can sort that one out for me.
Thank you, Kevin. I'm sure Elliot will more than happily sort that out for you to repeat what you said there. Thanks, Elliot.
Yeah, no problem at all, Kevin. Yes, I think we've given over the past few weeks now, we've started to give out more up-to-date, more current figures from ourselves about the fines that we're issuing. Most of the figures that go through from ourselves go through to ACRO, who process the tickets, and then once they've all been processed and there's no dispute, they then go through to a database which is then produced for the public. But actually, you know, we've taken a decision here locally that we think it's important, given the level of figures we've had, to show you just how much support local public health priorities. So yes, you will still get those national figures come as well, but we have been reporting on these for the past couple of weeks anyway. In relation to the £10,000 fines, that my understanding is exactly the same situation arises. Those ones that you've seen published at saying I think 10 now, actually we still have issued 14 of those. It may be that 4 of them are held up in processing, either in dispute or need further work doing on them. So it's more of a process thing than whether or not we've actually issued that fine. I hope that kind of clears it up. I did note your point around us being top in the country for per 100,000 in relation to fines, and again I think I've answered that, but it is important for us. If you look at the level of figures in this county, I think the enforcement, we've taken it very seriously. A high proportion of risk in the county, and the police service working really closely with public health to make sure that we manage that as best we can in support of them.
Thank you very much, Kevin. Thank you for that question.
Thank you, Ian. Thank you, Elliot.
It shows a high level of enforcement, which is what we need against these few that do break the rules. So I think that's the key message there. I'm going to come on now to Alice Wilson from Northamptonshire Live. Alice, hi, good afternoon.
Hi, thank you very much, Councillor Morris. First of all, just one very quick one about vaccinations. We've had reports from some local people that there's been quite a lot of GP surgeries that have been struggling a little bit because of staff having to self-isolate. Has that had any effect on their ability to hand out vaccinations at all? And just quickly for Superintendent Foskett, just anecdotally, obviously there's been lots of fines handed out, but have there been any instances of people coming to or through Northamptonshire from really far away, making, you know, ridiculous journeys? I know that's happened quite a lot elsewhere in the country, so I just wondered if Northamptonshire has had to deal with that. And also quite a lot of our readers have had lots of complaints about scams, scam emails, scam phone calls, scam texts about the vaccine. Are Northamptonshire Police doing anything about that?
Thank you very much. Some very good questions there. I'll probably come to Dr. Joe Watt on the question of the surgeries, and maybe Chris might want to add something to that, and then we'll come to Elliot on the scam side and the bit about enforcement that you were talking about. So I'll go to Joe first. Joe.
So I think it's important to mention that there's a whole host of different people involved in the vaccination services, both those at GP services and also at the mass vaccination centre. There are lots of volunteers. There are some amazing people who've stepped forwards, particularly for moving people through the building. And it doesn't always have to be a doctor or nurse doing all of those elements of the clinic. The volunteers are able to support. There are people like Chris who have trained to be vaccinators, and so it's a whole host of different people, and they're not the same people as the ones who are delivering the frontline services. So there are plenty of people. There are actually more volunteers than many services need. And people have been really stepping forward, and we're extremely grateful for them. And it's important that we look at what are priorities for us as a county. And one of the things that we've done is all the medical and nursing leaders from all of the organisations across the county are making sure that we have plenty of staff for the really key priority services. So, and vaccination is absolutely one of those. So staff will never be taken off vaccination services where they're required. They will not be taken off the urgent and emergency services. And we're all working together to make sure that those services are prioritised, that they have all the staff they need. Equally, when staff are poorly, we make sure that they go home so that they don't infect the other team members as well. But we are making sure that we have everybody we need. We do have plenty of staff. We have not taken anybody from another area to look after the vaccination services, and we will not be standing down vaccination services. This is the way forward. We have to push on this together, and everybody's doing an amazing job.
Thank you very much, Joe. I'll bring in Chris. Chris.
Well, very little to add, actually, to what Dr. Watt said. It's natural when you have a large staff group that some people are going to be poorly on a certain day. That's human nature. To give you an idea of scale, at any one time at the vaccination centre, we have 62 people at work, and we have around 700 shifts to fill a week. So it's natural that you will have some ebb and flow, as in any employing organisation. When that happens, we cover those shifts and we don't affect the service that we're providing. And that's the assurance that I'd like to give on top of what Dr. Watt has said.
Thank you very much, Chris, and thank you, Dr. Watt. I'll bring in Elliot now with that second bit of the question, which was around enforcement, and I can't remember the actual other question, but I'm sure you can, Elliot.
Yes, it can. Yeah. So in relation to people travelling through the county, no. In short, we do get it. We do get people. It's a hub. Lots of people come here for lots of different business reasons. So yes, we have had people travelling through, and some people who have no business being here. I don't have any examples to give you about somebody travelling hundreds of miles. Clearly, it was well reported in the media. We've exported a couple of people from Northamptonshire into other counties to do that. But not that I'm aware of from any great distance. Just in relation to the scams, I know we'd spoken about this last week. There are a number of scams out there at the moment, and you know, they're preying on the most vulnerable, aren't they? At the end of the day, these are people who really want the vaccine, really need the vaccine. And I can only describe the kind of individuals who do this as just disgusting. It upsets everybody here at Northamptonshire Police, and it upsets the general public when they hear of this disgraceful kind of scam going on. You know, if you're worried at all, you can call us. If you get an email or a text message and you're not expecting to be on a vaccine list, it's likely to be a scam. And if you're worried that that's the case, get in touch with us. We'll give you the advice you need, or get in touch with a healthcare professional that can help you with it. If it looks too good to be true, it is. That's the golden rule. So do not be fooled by some of these people, and we will do our utmost to clamp down on it. But yeah, they're terrible people who do this. And if we do actually investigate it, we will throw the book at them. Make no bones about it. We will do.
Thank you. Yes, disgusting individuals is about right for it, I'm afraid, isn't it? And no one will ever ask you for your bank details or indeed any other information to do with your vaccination or otherwise. So yes, please report it all to the police, and hopefully, as Elliot says, we can find these individuals. It's the nicest word I can use, and prosecute them hard for taking advantage of such a horrible situation. Excellent. Right, I've got a couple of written questions from the Global Media Group, which I'm going to read out because they don't attend. So the first one is, following last weekend's national coverage of the NGH being named as one of 3 hospitals not vaccinating vulnerable inpatients, has there or will there be a review of that policy? And I think that's for Deborah probably did answer it in her opening statement, but as it's a written question, I'll give her the chance to answer it again. Deborah.
Yeah, thank you. So yes, we have reviewed the policy, and I'm pleased to let everybody know that over the next few days, well, certainly by the end of Monday, we will have a procedure in place to be vaccinating our inpatients. Thank you.
Deborah, very clear answer to that one. Thank you. So then there was one which I think is for Chris Pallow. With the Malton Park Vaccination Centre now operating, does that have any impact on supplies to other sites, including GPs and surgeries? And if there was to be any reduction in supplies of vaccines due to supply issues nationally, would Malton Park be the primary location for Northamptonshire's supplies at the expense of other sites? I do feel you've already answered this as well, Chris, in your opening statement, but it doesn't do any harm to repeat the answer. Chris.
Thank you. So absolutely not. No supplies have been diverted from GPs to Malton Park. We have been in negotiation with NHS England to ensure that there's sufficient vaccine for all of the priority cohorts, and I'm absolutely confident that vaccine will flow. And the majority of that will be going to the GP sites, because we know We recognise that patients much prefer to go to a service that's close to their home, and which many of them will have already been called to. So absolutely not, there's no diversion. If there was to be a reduction in supplies nationally, would Malton Park be the primary location? I can't speculate on what might happen in the future, but what I can say categorically is primary care is the main recipient of the percentage of vaccines that come into our county, and there's no intention to change that.
Thank you very much, Chris. But that's the end of the written questions, but I do have a hand up. So I'm going to come to Alastair from the Chronicle and Echo. Alastair, good afternoon.
Good afternoon. Can you hear us?
Yes, I can hear you.
I always check, my microphone's quite bad. Sorry, I don't know if this information's in front of you. Can you give us any information about how many staff and frontline staff at both hospitals have been vaccinated so far? I don't think they've been specified in any of the statistics so far. It might give some people reassurance.
Thank you, Alastair. Chris, do you want to take that one?
I'm happy to take it. Deborah might also wish to come in. You're absolutely right. I don't have the figures in front of me. But what I can tell you is the hospital hub at Northampton General was in the first wave and went live on the first day. And we have vaccinated thousands of our staff, well into the majority of them. I apologise, I don't have the figure. Kettering General also became a hospital hub in, I think it was the third wave, and have also made huge strides. Again, thousands of staff vaccinated at their site too. So I'm afraid I can't give you any further details apart to provide an assurance that absolutely there's been a very far-reaching programme of vaccination in both acute hospitals in the county.
Thank you very much, Chris. Deborah, I don't think you've got anything to add, but you may want to.
No, I haven't, thank you. I think Chris has covered that off. I don't have the numbers either, unfortunately.
No. I mean, will the numbers be available at some point? I think it would be handy to know. Are they likely to be numbers that we can give out, Chris?
Almost certainly in the future. We are having to report on the numbers of health staff who are vaccinated because they fall into the priority cohort. So we are passing that information to NHS England, or we're in the process of gathering it for NHS England. So it stands to reason in time it will be published in terms of our penetration into that cohort, along with the age groups as well.
Yes, I mean, I think it's important to know that, because obviously we're not trying to not tell people what the figures are. It's just, there's a chain of command with these figures anyway, and they have to be released. So as soon as they are, I'm sure we'll share them, and they will, as Chris says, probably reflect a pretty impressive uptake of the vaccine. So thank you for that, Kevin. Thank you very much for that, sir. Oh, sorry, Alastair. Apologies.
If there's time, actually, there's one more. Sorry, I've just been handed a question by my colleague Alison from the Northampton News team, who couldn't join just today. If it's all right, she's asking if there's any data available for how many patients go into Kettering or Northampton and are then tested for positive when they're there. It's not so much that infections on the hospital wards, but tested positive in the hospital might give a rate of ingoing and outgoing. I don't know if that's available anywhere or can be provided.
I don't know. Deborah, would you be able to shed any light on that?
Yeah, I'm just looking at my data at the moment. So hospital-acquired COVID infections, this is what you're asking for, is that right, Alastair?
That sounds about right, thank you.
Yeah, okay. So across both hospitals, it's been 404 in total. And that's since March last year.
Oh, wow, okay.
So just in comparison to the patients who have been positive, recovered and discharged, that's 2,400.
Thank you very much, Deborah. That's very useful. Thank you. I'm going to come now to Stuart Ratcliffe, who always waits very patiently. Stuart, good afternoon.
Hello, good afternoon. Just a quick clarification just from Katie Brown, if that's okay. When there was the outbreak at Temple Court, we were given the number of deaths at that care home. I just wondered why or when we would get any clarification about what was taking place at Seagrove House.
Thank you, Stuart, for that question. Katie actually isn't on the call anymore because she had to go to another meeting. So I don't know whether Rosin would like to comment on that, if Rosin is on the call still. Is Rosin on the call?
Hi, Councillor Morris. And I'm afraid I don't have the the details at hand, but I can certainly take that away as a question that we can come back to Stuart with.
Sure. If you don't mind, we'll come back to you outside the meeting with some detail on that. I do apologise, but
thank you very much. Thank you.
Very busy and had to go off to another meeting. So I've been asked as well if Alice has asked if she can come back in because her blue hand isn't working. I know we're not supposed to take questions in the chat group, but since her blue hand isn't working, I'll give her the chance to come back in. Alice.
Yeah, sorry about my blue hand. Just a very quick one for Superintendent Foskett. Obviously the snow was quite a welcome sight for many people last weekend, but did it cause any more issues in terms of mixing households outside? And with more weather warnings for snow over the weekend and into next week, are you anticipating any more problems?
Thank you. No, I mean, we didn't tend to get too many reports of snowball fights and things going on and mixing of households. I know there's been a one further up north that's been widely reported, and a large organised one. The main thing for us is actually with the snow, people tend not to go out, so it's actually better, and they tend not to make unnecessary journeys. And so actually, I know it might sound a little bit contra to what you're saying, but when the snow comes, people stay in their own houses. So no, we're not anticipating any further reports or any more than we've already got. So.
Thank you very much, Elliot, and thank you, Alice. We are running a bit ahead of time. If anyone had another question, we could probably just squeeze one more in if anyone wants to put their hand up. Alastair, back to you, sir.
Hello, sorry, only if there's time. As I say, I've spent this week interviewing a number of staff from NGH. I did it as part of the media opportunities. I know lookies were available as well. I say all three of them were very fraught. They were talking about how staff are very much exhausted. They're all in good spirits, I must say, but again, that exhaustion is just prevalent. You were saying earlier that mental health is a concern at this point. What's being done to help out staff mental health? Before cases go down, the pressure will go down eventually, of course, but what's being done to help people?
Thank you very much, Alice. You raise a very good question there, Deborah.
Yeah, thank you for that question, very good. So the research actually came out after the first wave, and it came from the University of Birmingham and King's College. And I think it was around 50% of staff are likely to have mental health and perhaps problem drinking, with 1 in 7 suggesting that they may self-harm or are talking about suicide. Now, that was at the end of wave 1. If you think about where we are now, wave 2, much more pressure, more intense. The occupancy within the hospitals is definitely not as low as it was in wave 1. So it's definitely more challenging for our staff. So what are we doing about it? We have got what we call an SOS team, and we have access to this team in both organisations. And this team provides psychological support. They will signpost if need be, they'll listen, they'll just generally support. And people can self-refer into that, or you can refer a colleague. Both hospitals have set aside specific areas for staff just to have some downtime. And so within NGH, that's called our NGH space. And that's just a quiet area where people can go to reflect, get a cup of coffee, read a book. We've also got access in both hospitals to psychologists, psychology support if needed. And we've also done quite a lot of health and wellbeing initiatives. So things like giving out, in the first wave, we had a lot of donations from the public and from businesses, not so much in the second wave, but as soon as things come into the hospital, such as hand creams, I think this week we've had something from Clarins, for example, we're giving those out to the staff. And sometimes it's just the little things that make the difference. We have live briefings every single day in both organisations where staff can log in, ask questions. The senior leadership team are out and about in the organisation, making sure people are okay. And also, I think one of the things that we have come up with is staff in back office areas going out to the wards to support and help, because we know that sickness is higher than we would want. So it's about some staff supporting others in doing different roles, but that of course in itself can bring its challenges. So we have a lot going on for our staff at the moment, and we are very much in touch with them. And as you say, that they're upbeat yet tired, but they are doing an amazing job every day.
Thank you very much, Deborah, and thank you for that question. We'll probably close the meeting shortly, but I wanted to, we haven't heard from Councillor Jonathan Nunn or Councillor Tom Beattie today at all. I wanted to give them the chance to just sum up how they're feeling, given that their areas are two areas that are still showing some significant rates of infection. If I come to Jonathan Nunn first, if you wouldn't mind. I'm sorry to drop you in it at the last minute there, but I know your thoughts are always very, very well received and valuable. Thank you, Jonathan.
It's very kind of you, Ian. In practice, what an excellent briefing. I'd like to thank on behalf of all of us, actually, the professionals who come week after week to keep us posted on what's going on. It's been a long slog, hasn't it? We can see some light at the end of the tunnel. I think we're all pretty tired, not just those, but of course, especially those who've worked so hard in the health services and other services, but everybody is thoroughly fed up. And let me just join the comments that have already been made to urge everybody, please, please, please continue to be careful. We're on the way now. We can start to see the lights at the end of the tunnel. And thank you for everything that you've done. I think that's about it from me, and thank you very much.
Thank you very much, Jonathan. Tom, if I could bring you in. Tom.
Yeah, thank you, Ian. Pretty much the same as what Jonathan has just said. It's comforting, I think, to see what is, albeit slight, at least a reduction in the levels that we have been seeing in Corby recently, and that's that's a reason to be thankful, but it's not a reason to become complacent. I think there are still serious issues facing us, and it's important that we continue to observe the guidance around face, space, and all of those things that people are being asked to do to ensure their safety and other people's safety. Just one point I would like to make. It's actually in the chat box, so I think people can see it themselves, but it was just a note that Rosin Harris sent to me to talk about the success of the asymptomatic community testing site in Corby. It's working really well. It's just been going for over a week or so now. We had a number of CBC staff volunteered to go in and work at the Lodge Park Sports Centre. It mentions one of them in particular, Julie Cardwell, who's done a fantastic job there. They're working at 100% capacity, and appointments at the centre are going to be increased next week. So we should be seeing something like 500 people a day go through that lateral flow testing centre. So that's positive, and I think we need to welcome those positives when they come along, but not get into a position where we think, well, we're over the worst of this, because we're far from that, and we need to continue to do the things that we're being asked to do. So thank you, Ian.
Thank you very much, Tom and Jonathan. And really, I think I know Laura has one more question, but I think we're out of time. So apologies, Laura. If you can table that one for next week, or bring the question to us outside of this meeting, I'm sure we're all more than happy to help answer it. So it just remains for me to close the meeting and say thank you so much, everyone who's attended as always, and thank you for answering all those questions. Thank you to our friends from the press who have asked some searching questions, but we're always happy to answer them. So stay safe and well, and I'll see you next week at the same time next week for the next press conference. Have a good weekend.